webinar, this is an extra event that we've organised. Actually, as a result of one of our existing members asking me by email in November saying he'd heard about this enhanced CPD scheme, there were kind of various things that weren't that clear. Could we possibly get someone from the GDC to come and present? So I thought, well, there's no harm asking. First of all, a big thank you to Martin Spencer, who's the media manager actually at the GDC, with whom I liaised over this and has been an absolute gentleman and has got this organised. And of course to Lawrence for agreeing to come and do this.
Huge pleasure. Very good evening, everybody. It's a great pleasure to come out of 37 Wimpole Street and to be actually talking to dentists and dental team members. This is something that's very much in my heart. I've spent my whole life looking at dental education, and CPD is one of those things that really is centre to everything I've ever done in the whole of my career. For those who don't know me, my name is Lawrence Mudford. As well as being a dentist working in practice as an associate at the present time, I work within the Dental Education for Health Education England in Kent, Surrey and Sussex. And as Andrew quite rightly said, I'm also one of the 12 council members for the GDC. Since I qualified in 1981, one of the major changes that I've seen is in the area of CPD. When I first qualified, there were two streams. There was hospital learning, which was focused on career development and orientation. And then for the 90% of people who qualified, dentists who qualified in dental schools, there was a choice of either what we would call Section 63 courses at local postgrad centres, or there were BDA evening meetings. I've deliberately said there for dentists because there was little in the way of CPD for other dental team members. So dental nurses had very little apart from reading the odd journal that was left behind in the tea rooms of dental practices. Now CPD choice is greatly expanded and includes specific choices at long last for all members of the dental team. And one of my course attendance still features, of course, but it's competing with online learning, journal quizzes, and that might be something we discuss in questions later, to the other end of taught MSCs that are aimed at the busy dental team member, and of course expanded scope of practice courses. The change that I've seen in what is now 35 years of being a dentist have been great. But I think in the last 10 years they have been rapid. And what I really like now is the ability that all members of the dental team have the opportunity to expand their roles, to develop their learning as a part of their personal development as part of the dental team. Following a review of the proposed enhanced CPD scheme, there's an aim to introduce a framework for dental professionals to focus on CPD that supports them to practice in accordance with that document, the standards for the dental. I thought I'd just pause here for a moment and ask for your input. I'd be very interested to see what benefits you would actually like to see in a brand new scheme. Some of you may well have some very strong ideas of that, because in actual fact the consultation has gone on for quite a while. Love that one from Steve. Ensure that CPD has benefit to patient care. I think one of the great concerns I've always had about CPD is the very obvious one. It can be a tick box mentality just to pass something at the end of a year for the GDC. And I think what we all really